years, okay, we've been trying to look at opportunities for funding that our participants can take advantage of. We understand that it's not easy to fund international education. It's expensive, especially if you want to go to a good nation. So far now, we finally arrived at one that we believe that with 100% surety we can present to you, and it can help you to realize your dream. So we'll be talking about that. That normally would have been the very first part of the program, but because today I'm having two guests on the program, one of them is speaking to you from Atlanta, Georgia in the United States, and the time now there is 2:06 a.m. She should be sleeping, but she's taking the time out to share with us, and so I don't want to keep her. And you know, the funny thing is that she's also at work, actually. So, and she's a nurse, a very senior nurse with several decades of experience, and she could possibly have maybe emergency calls during the period that we are going to be discussing. So I would like to have our guest first, then we are going to go on to talk about the loan after their discussion. So thank you very much, Ms. Posede Odedele and Dr. Samaila Musa Chiroma. Thank you for joining us in the meeting today. We appreciate your help and your willingness to share with our participants. I know that I have a list of questions, so many of them, that I would have loved to. I'll be asking many of them anyway, but I think in the course of your presentation, you would have addressed many of these questions. So I'm just going to leave the floor open. I would like you to just go ahead and make a short presentation to our participants. But before you do that, I would like to also introduce them to you. Like I've mentioned, Dr. Samaila is a senior lecturer at the University of Newcastle Medicine, Malaysia. That's the campus of a university in the United Kingdom. He was previously a lecturer at the University of Maiduguri, Nigeria. He studied for his PhD at University Putra, Malaysia, and is currently a full-time staff with the University of Newcastle here. He has his bachelor's, master's, and PhD in anatomy, and so is a lecturer in the Faculty of Medicine. So he will be speaking to us about opportunities in the medical field. I know that not everybody wants to work in the hospital, even though you want to work in the medical field. So if you are interested in other areas, including academics, you will be able to learn something from him. Ms. Posede Odedele is also here. She's the one speaking to us from Georgia. She has been a nurse for, I think, as far back as the early 90s, if I'm not mistaken. She has worked in Australia as a nurse. She has worked in South Africa. She worked in Nigeria, and she's currently working in Georgia, Atlanta, Georgia, in the United States. Incidentally, she's my childhood friend. We went to elementary school together. So she had many years of experience in nursing and generally in the field of medical practice. So she's going to be sharing with us. Thank you very much again. So I'm going to leave the floor open for you to just make your presentation to us. Then we'll go into question and answer before we address the loan issue. Thank you very much. So we'll start, ladies first. So we'll start with Mr. Odedele. Unmute yourself, please. Yeah.
Good morning to you all. My name is Posede Odedele. I'm from Iwo, Osun State, Nigeria. I started my nursing career as far back as my friend was right. Over 30 years now. I started from Nigeria, to South Africa, I spent about 7 years in South Africa. Then I moved to Australia, and I spent about 4 years. Then eventually I found myself here in America. Nursing as a profession. Actually, I didn't like nursing. I must be. I must tell you, it was just like my mother's wish, which eventually turned up to something good for me, because even when I was in School of Nursing back in Nigeria, I was still battling with JAMB. There was a time I got admissions for chemistry, education. I wanted to go there. People said, "Oh, you want to leave nursing for education?" I said, "I just don't like this profession," because actually it was my cousin that obtained the form for School of Nursing then. My friend knows that my cousin very well. Her name is Bukola. She was even the one that got the School of Nursing's form. Then when I saw it, I said, "Oh, why can't you obtain one for me?" Then let's try together. Then I did. I could remember that time when we went, it was about 5,000 students back then. And they are only going to take 25 students. So we did a test, and I passed. They called me for the interview. So when we went for interview, we were about 75 again, and they just need 25 basic students. And the post-basic, they're going to be 5 post-basic. They're the people that have done their midwifery before coming for nursing. So that is how I went, and eventually I was lucky to be part of the student, and that is how I started. That was 1989. So I did my nursing from 1989, general nursing from 1989 to 1992. Then I went for my midwifery in Ilorin Teaching Hospital, 1993 to 1994. By 95, I think I moved to Lagos. Then I started there working with private hospitals and other things. Then in 2001, I just decided to go to South Africa. That is how I started. It was a rough journey, because we entered in the wrong way. We went as visitors, and we just decided to stay. It was a real battle, because when we got there, we waited for about 6 months before we could write professional exam to start working. You know what it takes? If you don't have money and you go to foreign land to stay for 6 months. Then when we got there, then to cut the story short, we found ourselves in the system where when you move out of Nigeria, it's easier for you to go to anywhere in the world. So when we got there, we were able to move to Australia. So that is how we started to move around. Yeah. I really thank God. Actually, I didn't like nursing, but
paid off.
But now I think I'm reaping the
benefits. Thank you very much for that background.
So
yeah, I think
if you want to take nursing as a profession, I will give you a thumb up. Go for it, and the Lord will help you.
Thank you very much for that. I think one thing that we can pick from there is, please go in the correct way if you have to go.
Yeah,
don't go wrongly. It will make your life difficult. Yeah, yes. I think that's one lesson that we can learn from that. Okay.
Then another thing, can I add one thing?
Okay, go ahead, please.
By the time we got to Australia, we went to Australia through the right way. We got the work permit before leaving, and we quickly settled that.
Okay.
So
Thank
it's
you.
better to go in the right way.
Thank you very much for that. Let me just ask one more question on that for you to enlighten us on the different opportunities within the nursing profession that people for people who are just maybe they're just finishing high school or they are just starting a career and they are thinking about something in the medical line. Not everyone will love maybe nursing or bedside nursing. What are the other options that are there that they can explore?
There are so many options if you don't want to. Like currently, I work for insurance company. I left bedside nursing, but sometimes when we need money, we go to bedside nursing. So there's so many, the psychiatrists, they are there. They don't need to be, the patient in the psychiatric area, they can do everything by themselves. Maybe to give them medication. There are so many areas you can work in insurance company, you can health insurance company, you can do home health, you can, so many areas to work if you don't want to do bedside nursing. Yeah.
Okay. Thank you very much. Let me come to Dr. Musa. Can you just introduce yourself briefly and tell us opportunities available within the medical field outside of the hospital?
All right. Can you permit me to share my screen?
Please go ahead.
Because I have something small. All right. I've been introduced already. My name is Musa Samaila, and thank you for this opportunity to share a little that I know in this field. I'm 10 years into academics. Precisely 2013, I joined university as a lecturer. And in 2023 now, I'm 10 years into the field, working in university as a lecturer. As my other colleague have rightly said, she went to nursing by accident. I also found myself in human anatomy by accident. Actually, I applied for medicine. Then they sent me to human anatomy. But I have full support of my parents. I could remember far back then, 2000, my father bought me anatomy books that worth 30,000 naira. And then how much was the salary then? Like 3,000 to 5,000, because it was Abdul Salamin Obasanjo that even increased the money. So I just entered anatomy with passion, and today I have my PhD in human anatomy with specialty in neuroscience. So thank you for this opportunity. So I've been in medical school all this while. So, and then the topic given to me is career opportunities in the medical field. There are 101 of them. And I don't know who are my audience. Are they school students? Are they parents or people that want to Japan? So who are
Everyone
my
is here.
Everyone is here.
Everyone is here. Yeah.
So I think I will concentrate more on the students so that at least their parents will hear and can also direct them. And then those people that want to Japan like us, I think you are in the right place. Even after this meeting, we can still meet and continue talking. Right? So now the career opportunities in medical field, there are many, as I said. And then this one of the field that we have ever growing opportunities. You remember during Corona, everybody is being shut down at home. But they say medical people have to go to work because you are needed. And then as I'm talking to you, even last week we had international conference here of specialists in medicine people all over the world gathered here in Newcastle, Malaysia. They said there are shortages of medical personnel all over. So if you want your child to go and work in the medical field, I think you are welcome, and then there are opportunities. So now I have some catalog of works that people can easily join. I started with this physiotherapist and physical therapist. This is one of the field that is not many Nigerian universities are doing that, but we are lucky there at University of Maiduguri, we do have it. What is their work? Their work is rehabilitation. Some people will undergo accident and they may not walk. You can see from my screen, this is trying to help this man, and then you can see this lady also, she's trying to help this man to walk. Not only this, some people may have stroke, some people will have different kind of things, some people may have some congenital abnormalities that may come up with. So now these physical therapists, they actually work there. And then I remember a friend of mine, Dr. Gang, just he announced in his condo when I was in KL, Kuala Lumpur, that actually I'm a physiotherapist, you can come down and to my place so that I will assist you in one or two things. You know, in a condo, you can have a lot of apartments, 20, 60, 100, 80, and the rest. And then from that day, he gave them 1 week physiotherapy, some to their children, some to their parents, some to the elders. From there, he has been referred by many people. Now, Gang have bought a new house, a new car, and he is still making money. Apart from his lecturing job, now they are calling him from one place to the other doing the work. Education. In the physiotherapy, the education is really hard. You have to undergo undergraduate, postgraduate, and before you get your license. Even in the University of Maiduguri, you spend 8 years for you to get single degree there, but at postgraduate level. But when you are being licensed, believe me sincerely, the salary is good. And if you want to do private practice, just introduce yourself. Many people are looking for people to massage them. Many people are looking for this physical rehabilitation. Pharmacy is another place because we in anatomy, we give lectures to anybody in medical field. You have to pass through anatomy. So pharmacy is another place that we don't need to talk more about it because you know the role of a pharmacist in the society. You can see here the first picture, you can see this lady, she's trying to compound drug. Some drugs are being brought in higher concentration. They are the one that reduces to low concentration. And you can see the other man is just like picking drug counting. You may think in the hospital they are just there to count drugs. No, they are also checking the doctor's prescription and see the interaction of drugs. Sometimes pharmacists will send you back to your doctor and say, please do some things. What was he saying? Because some of the drugs may be poison to you when they interact in the body. So now, apart from working in the hospital, you can also work in a company because they produce the drugs and they sell it to the society. You remember what happened with Pfizer in Kano some years back? Many people died as a result of the vaccine that they produced that is not good. So now, as a pharmacist, these are people that are very careful, and these are people that they have very high marks, even for them to pass. You know, in medical school, we allow those that are studying medicine to pass with 50%. But those that are studying pharmacy, all the pharmacy ethical courses, 60% is the pass mark. So if you know that your child is so meticulous, if you know that your child is so good, that and he is careful in his life, I think you can send him to pharmacy school. There are a lot of opportunities that he will get, and then after graduation. The salary may not be as good as a medical doctor, but if he have that business experience, in fact, the money he will be making, he will even invite medical doctors to work for him. Another thing, we have the medical radiography. I can remember trying to play with them when I'm lecturing. I say, you are photographers. What are you doing? Then they will say, no, we're not photographers. We are radiographers. Okay, what they do? What they do is actually more than what we think. They look for patient history and see whether the treatment or the diagnosis being given, the patient can undergo through that diagnosis or not. The right dosage of radiation that will be exposed to the patient, they usually check it. They usually give patient confidence on whatsoever they are doing. So as you see them like this, it's not just to snap the picture, but rather they are doing more than that. And these are people that they do a lot of mathematics, they do a lot of physics apart from the anatomy that we are giving them. So in every hospital, if there is any height, maybe people have brain injury and the rest, they have to look for these people to carry out CT scanning for them and the rest. So now these are people that they are just like the eye of the hospital, the eye of doctors and all medical practitioners. You spend 5 years and you have 1 year internship. And after that, your salary is not bad, it's good. And you can work in many different diagnostic centers. Medical laboratory sciences is another degree that is there as a hot cake in medical field. In fact, they are the people that direct all medical personnel So now there are about 4 different departments under this medical laboratory sciences. We have histopathology. These are people that after surgery, they will check whether there is cancer or not cancer. My wife happened to be one of them, but he's a histopathologist because she's a medical doctor. She was giving me a story that they want surgery. I said, what happened? They said, no, it was a very serious surgery that they want to confirm whether there is a cancer or not cancer. So now they have to go together with those scientists in histopathology. So now they are there beside the operating room. As soon as they open the patient, they remove small amount of tissue. They give it to those histo people, those lab scientists that specialize in histopathology. They prepare the slide for them at that spot, and then they check, okay, there is cancer, okay, remove everything. So now these are people that are very essential in the field. So now they determine what is going to happen to the patient, because when they say this is this, this is this. Why? Because they have the instrument and they have the things to prove whether there is a disease or not disease. So if you go to chemical pathology, microbiology, hematology, these are different branches of lab scientists, whereby in chemical pathology, those testing for diabetics and the rest, you go and check your blood sugar and some blood parameters there. Then hematology, you know, always in the hospital, you go to blood bank, you are looking for blood, you go to hematology. Microbiology, they are the ones that are checking the stool and other things. Apart from this, if you go down, they can be, in the microbiology, there can be even immunology, mycology, virology. All these are different branches in which they are dealing with microbes. Apart from them, we have nutrition and dietetic. This are a field that is new in the medical field to some extent, but not very new. But now we have degree. Nutrition is just anybody that have information about food can tell you the right quality of food you eat and the rest. But as a dietetic, these are people that undergo 4 to 5 years degree, and after that 1 year internship. They go to hospital and give advices to patients. In fact, sometimes they even run clinics and see their patient. So now they give expert review on the food that you're supposed to eat. If you have diabetes, those people will have blood pressure, some children that come with malnutrition, and some people that are obese. So now they give you recommended diet and then the things that you, in fact, they prescribe food for people. And then as they graduate from school, they have a lot of opportunities. They can work as a food safety auditor, they can work as a registered dietitian, as a health advocate, they can work in different places. You can see the list. The list is just long. Time given to me is small, so I have to move again. Respiratory therapist, just 2 years. We call it as an associate degree. Some of this work, we don't have them much in Nigeria, but during COVID, these people really work. That's why I want to just have to highlight at least about this respiratory disease. Just an associate degree, 2 years, but the salary is good. So now people that have asthma, people that have lungs problems and the rest, you monitor their breathing, you check how they move, and then you help them to breathe very well. Radiation therapists. Apart from radiographers that we checked earlier, we have those people that can spend 2 to 3 years and have a degree as a radiation therapy. You know, some people that are undergoing different sorts of therapy because of radiation, they pass through this people. So you go and spend only 2 years, 3 years, you have an associate degree, and then the money is good. Though there are some little exposure that you may have, but when you protect yourself very well, that exposures are little, and then you just get your pay. Then doctor of veterinary medicine. We've been talking about human being. Veterinary medicine is also a health. So now it's a 6-year degree, and then we know they take care of both large animals and small animals. If you just go out of Nigeria, you will know that how people consider their animals. You can see a dog here, undergoing CT scanning. You can see a dog. They are checking whether they are checking the heartbeat of a dog. You can see they are doing blood transfusion for a dog here. You can see they are undergoing surgery for this should be a horse. So now, as a veterinary doctor, if you are outside Nigeria, there are a lot of opportunities. I remember my sister-in-law traveled to one of these Scandinavian countries as a veterinary doctor. she said everything in the farm is automated and they are looking for veterinary doctors to work there. So a veterinary doctor, to become a vet is something that is very, very important. And then a lot of things. And then with the coming of this One Health, you remember Corona is from animals and then disturbing human beings. So now there is a collaboration between the medical doctors and then the veterinary doctors. So now even the health is becoming one because of this zoonotic disease. So it's something that when you have it, you can work anywhere, even in the medical field, as a medical, in the hospital, and then they are good researchers. I could remember my friend Dr. Doze is doing his research now on coronavirus. They are producing vaccines en masse. Veterinary medicine, but he just specialized in virology. All right? You can have bachelor in dental surgery. Bachelor in dental surgery, some people are saying, why are you disturbing yourself? Everybody is working because you want to eat food. So these are people that take care of your mouth. These are people that take care of your teeth. Old people cannot eat bones because their teeth are not strong. So these are people that are very, very essential in the society. You spend about 6 years just to get the first degree. But after graduation, very small money you need, not much. You can set your small 2-room apartment, you have your own private clinic. And then many people will come, you'll have your money. There are a lot of specialties in this field, but at least now we're just trying to give an overview of what people can do and what people can get. Then you also have bachelors in medicine and bachelors in surgery. That is MBBS. A lot of people are there. So these are the medical doctors and they are head of medical team. Each medical team is being led by this set of people. Okay, so now you spend 6 years in medical school, and after that, then you start your profession. So now you can go and specialize and become a surgeon, or become a psychiatrist, or become a pediatrician, depending on the area or the field that you want to specialize as a medical doctor. So now I have these 10 courses that I give you out that you can send your children to join and to do. But we have other list of courses that I have here with me that I may read them out for you. You can be an optician, you can be a dental assistant, you can be a speech pathologist, you can be a radiological technician, you can become a radiotherapist, you can become a physical therapist, occupational therapist, health wellness, you can become a diagnostic medical sonographer, you can become even a dental hygienist, you can become a psychiatrist. There are a lot of things that you can do in this medical field. So now anybody that is just interested in medical field, I think even after the webinar, my address is there, Dr. Bosede is there, we can share with her. But I cannot close my presentation without showing you where I am and the things that we can even offer in the medical school here that I am. Newcastle University Medicine, Malaysia. We offer MBBS, Biomedicine, and Foundation. So now, this is actually a UK university, but they have a campus here in Malaysia. So now, our students are in both campus, and they write the same examination, the same lectures. So now the lecturers are there, and some are here. But some of the courses, some of the disease like dengue fever that is not found in the UK is here in Malaysia. It's only a Malaysian lecturer that will take it. And then everybody from here and those in UK will see and understand. So when our doctors graduate here, we usually give them 2 certificates, 2 licenses to practice in the UK as well as to practice in Malaysia. So now you see advantage. So you can send your children here. If you don't have enough funds to send them to UK, they can just come here to Malaysia. And after graduation, they have the UK license. So they can operate in UK and they can operate in Malaysia. So now we move over MBBS, Biomedicine, and Foundation. Foundation is like remedial class. Biomedicine is a 3-year degree. The first 2 years, they will do it here in Malaysia. But the 3rd year, they will go to UK and finish it there. Then for the MBBS, we usually have exchange program. So some students will go to UK, while some of the UK students will come here to Malaysia. We have that opportunity when they are in year 2, and we have that opportunity when they are in year 5, and also in year 4, because here is after 5 years, we give you a medical degree. And it may interest you to note that these students, we have what we call early clinical exposure. from day one, MBBS part 1, the student will start going to teaching hospital and see what is happening. Newcastle is the first university in the world to start case-based studies. So now we don't teach our children just anatomy, physiology, or biochemistry, but rather we teach on case basis. So case 1 to 50. By the time you are in medical school, part 1 to part 2, we teach you case 1 to 25. And then from part 3 to part 5, from case 26 to case 50. So now by the time you have this about 50 cases, and when we say, okay, a particular case, when we say neurological disorder, we'll not only talk about Alzheimer's disease, but rather anything that has to do with neurology. So now we teach them, the anatomists will come and teach them the anatomy, the physiologists will show them the physiology there, the pathologists will come and show them the disease there, the clinical instructors will come and show them what is there, and then we'll also take them to teaching hospital to go and see what is happening there. In fact, let me give you a glimpse of just a story of a particular open day conducted by our students. They just organized a workshop and they invite people all over the world. People flew in. Some people come from different parts of Malaysia to come and see what these medical students are doing. They invited secondary school students to come and see what is obtainable here in Newcastle University. So now you can see here is our associate dean trying to welcome those people that are interested to become doctors. And you can see the head of clinical instruction is also trying to welcome those participants that are there. So now we give them a glimpse of what they see in medical school. This particular thing is organized by part 1 and part 2 medical students. Only a few lecturers are being called just to assist in what these students want to show the secondary school students and the foundation students from other places. You can see this is a workshop on choking. So now you can see this secondary school student trying to show these part 1 students and this lecturer, they show him how to tackle if there is a choking. You see, this particular one is just a workshop on respiration. That means some people may have a kind of cardiac arrest. So now cardiopulmonary resuscitation. This is just a workshop on it. You can see all these mannequins. They are there, and we are now teaching the students here on how to do the pulmonary. So now they will join it to their lab, to their phone. There is a software attached to your phone. By the time you are overpressing, it will alert you. By the time you are underpressing, it will allow you. It will alert you. So now the real amount of pressure that is needed or required, and then the things that you're supposed to do, you'll see it there. So now these students are getting what we call first-hand exposure to the things that you'll be facing in future. This particular one is just a workshop on bandaging. You see, this one have a fracture, they are trying to see. This one have a wound in the hand, they are trying to bandage it, and you can see how they are. So these are the things that we are teaching them in part 1 and part 2, and now they are trying to show it to the younger ones in secondary school so that they may have interest in medical school. We allow them to do blood grouping. You can see another workshop on blood grouping, and now you can see this particular slide. They are able to detect their own blood group, and everybody is happy. This particular one is a lecture on the heart anatomy, because for that cardiopulmonary resuscitation, we're supposed to give them what is the anatomy of the heart. So this is just one of the demonstration theater for the students where we present lectures, especially anatomy here, because the hall is a bit big, and then you can put something at the middle. So that day I was invited to give them lectures on anatomy of the heart. You can see the heart here. This is the hall. And this is since a secondary school student, I asked the school, just give me some chocolate. So this particular boy here, I asked him some question and he was able to answer. Then he get a bar of chocolate for giving a correct answer. Oh, this is a picture we just snapped at the end of the workshop. Half of the students that came, while the others are somewhere, so we just snapped a picture showing some love. Thank you for listening. Thank you very much. I can stop sharing my screen now. Dr.
Thank you. Thank you very much, Dr. Samaila. I think he has shown us that he's a lecturer. That's like a full course. Thank you very much for all the information. I'm sure people are taking note, and it will be a lot of benefit to many of our participants. Thank you for the enlightening presentation. I'll quickly go back to Mr. Dedele. I would like you to enlighten us about a question I will call, what does success look like in your field? And by that, I mean, what kind of salaries do people earn? And I want you to touch briefly on travel nursing while talking about that as well.
That is a very difficult one to answer. Well, it depends on the individual and how you can maneuver your ways, you know. Here in America, it depends on the state. But as a nurse,
let's say on average per hour.
Per average.
For a newcomer, not an old person. Yeah,
okay,
for a newcomer.
At least you will get something over $30 per hour.
Okay, $30 per hour. And you can work
more.
For how many hours are you permitted to work?
40 hours.
Okay. If you do more than 40 hours, what happens?
There's nothing happens. It's only in Australia that you can't do more than 40 hours.
Okay. In the US,
here,
if you can cope, you can do
you can do
hours
even
per day
120 hours if you want.
Okay.
Because here we don't keep one job.
Okay.
You can have up to 2. You can have up to 3. It depends how big your mouth
and how strong you can.
And how strong you are and your responsibilities. If you don't have more responsibility, you may not want to work much. There's some people that work even less than 40 hours per week. There's some. I used to have a friend back in Australia. She was working even, I think 12 hours in a week or so. A day, just work, not even up to 12 hours, because they work 8 hours. In Australia, they don't allow you to work more than 8 hours. But in America, you will work up to 12 hours.
Okay, so if you have to work in travel nursing, what does it involve? How much do you earn and how easy is it?
It depends on the states.
Okay.
Like state like New York, they pay big. California, those are big cities that you can.
And when you say big, what does big mean? How big is big?
You can have even over $100 per hour.
Okay.
It depends how you come. Even if you are in your state, you can hand up to that. It depends how you can negotiate your way.
Okay. So, and what does their job involve?
The job involved, they can take you anywhere. You might be living in Georgia, they can take you up to New York, California. They pay for your ticket, they pay for your hotel stay. And if you buy you a car, they buy you a gas, they pay for your mileage.
Okay. So why won't anybody want to do such a job?
It's very strenuous. There is nothing like waking up from your bed and you have everything around you that you can just decide, this is where I'm going to work tomorrow. But with the traveling, they can take you anywhere. They
so
will
your
take
life is
out of your state. They can take you out of your state.
Okay.
But if you might be lucky, even they can keep you in your state.
Okay. So as a travel nurse, do you have to be a travel nurse on full-time basis, or is it something you can just do when you are free?
It's a contract, something.
Okay.
Like the one I did 2022, it was a 10-month contract.
10 months,
but
okay.
With Amazon, but that kind of luck is not common, and they kept me in my state.
Okay.
So now I worked for them for about 10 or 11. Even after I stopped, they still pay me for 3 months.
Wow. That's nice.
After you stop working, they will still pay you. So,
that sounds good. Okay.